Masks have become the new normal across the world due to the COVID-19 pandemic. Health experts claim there is a condition of mask-induced acne and have named it Maskne. According to the Associate Clinical Professor of Dermatology at the Yale School of Medicine, Dr. Mona Gohara. Here in Ghana, some are forced to wear their masks continuously for 12 or more hours at a time. Aisha Ndiego, a victim of Maskne, is a nurse at the Greater Accra Regional Hospital. She explains that even though her skin irritation has reduced, the evidence is clear. She realized that it was a certain type of mask that caused the irritation on her skin.
What I've realized is that I reacted more to the N95, but then the surgical mask is better for me. So then these days I use the surgical mask instead of the N95.
Her colleagues, Doris Rowe and Samuel Janite, have also experienced some irritation, though not specifically on their faces. They went on to explain that people should be conscious of the type of masks that work for them.
I've realized that anytime I wear the surgical one, I have terrible headache, I have runny nose, I feel so irritable in my throat. So I normally use the N95, which works for me perfectly.
When I use the surgical nose mask, I feel a bit itchy around the nose and I feel like touching it. So every now and then I have to pull it, to touch it. Then again, if I use the cloth type, I get stuffy nose instantly. I mean, after some 5 or 10 minutes, I feel I have cold and I have to take it off a while.
Chief Medical Officer and Consultant Dermatologist at Rabito Clinic, Professor Edmund Delle, gives us the possible causes of maskne.
What we call in dermatology the pressure on the skin. The pimples, it triggers the eruption of pimples, aggravates the pimples, and then it gives rise to what we call in dermatology infection of the follicles, aggravation of the infection of the follicles.
Professor Delle further explains that as much as possible we must reduce the wearing of masks where it may not be necessary.
These are irritants. It causes irritant dermatitis or contact allergic dermatitis. And the treatment is actually to avoid using them. But of course, because we are in a pandemic and this is necessary that we wear the face masks, what I advise the patients to do, wear them only when it's strictly necessary, in crowded areas, in places when you are going to shop and where it's written that you should, and reduce the number of hours you use in wearing them.
It appears medical professionals are in the majority experiencing skin irritation on their faces. When the news team took to the streets, those spoken to had not seen or experienced such skin irritation.
No, not yet. Yeah.
For myself, I have not experienced it, but my friend complained to me that especially the one that are the foreign ones, when he used it, he has some rashes and stuff around the mouth and also around the nose. Yes, he told me that, and I asked him to use the local one. And so he's using the local one now, which is okay for him.
But Professor Delle details some advice to the general public that will help reduce cases of maskne.
Ghanaians have made it a fashion. They are in different colors, and some of them are so thick. And the thicker they are, the more occlusive they are, and they will not allow air to penetrate and keep your place dry, slightly dry, because as soon as the place becomes moist and they trust moisture in your place, it gives rise to this infection, this irritation. So as much as possible, get the light ones, try to avoid the colored ones, and don't use the mask as a fashion.
Nanama Anabempong reporting for GH1 News.